Hello and welcome to Fertile Minds. I'm Dr. Albert Jung. I'm a gynecologist, advanced laparoscopic surgeon, and fertility specialist at Queensland Fertility Group here in Brisbane. Today we are going to talk about some of the top warning signs for endometriosis. Endometriosis is a chronic gynecological condition. It's where endometrial-like cells that should be inside the uterine cavity are implanted outside of the uterus. When it impacts into the uterine wall, that is known as adenomyosis. It affects roughly 1 in 9 women, or those assigned female at birth. The symptoms of endometriosis can largely be broken down into pain or infertility. From a pain point of view, we talk about the 4 main pain symptoms, or painful periods, painful urination, painful defecation, and painful sex. Painful urination or defecation may not necessarily have to be pain, but can be disturbances of, including things such as increased urinary frequency, constipation, diarrhea, or bloating. Being a chronic gynecological condition, endometriosis can have a multitude of different symptoms, including tiredness, lethargy, impacts on mood, as well as relationships and mental health. There are several mechanisms by which endometriosis impacts on fertility. In particular, endometriosis can cause significant adhesions or scarring, which prevents the tubes or the ovaries from functioning appropriately. But also importantly, it can cause significant amount of inflammation and irritation, both in the abdominal cavity and in the pelvis, as well as the uterine cavity. If you suspect you have endometriosis, please do not hesitate to see your GP and/or your gynecologist. Painful periods that require more than simple analgesia, such as paracetamol or ibuprofen, or that require you to have time off work, are not normal. This is a sign of endometriosis and should be further investigated. If you're suffering from infertility, meaning you have been trying to conceive regularly for greater than 12 months, that is also a time to see a gynecologist. If you have a known diagnosis of endometriosis, I would recommend seeing a fertility specialist if you have been trying to conceive for more than 6 months. Thanks for watching. For more videos on all things fertility, feel free to subscribe.